Magaziner, the Magaziner Center for Wellness. I want to thank you all for coming this evening. And tonight we're going to be discussing chronic inflammation and its impact on chronic disease. And it's a very, very important topic. But before we actually get into the talk itself, I want to mention we have some very important upcoming events, because once a month we're trying to give a talk on a Wednesday night, usually towards the last Wednesday of the month, by the way. And these are completely free. You're certainly invited to come back. Many of you I recognize, you've been here before many times. And if you missed it, like we said, you can always watch it later on our Facebook page, which is Magaziner Center for Wellness. But I wanted to let you know, on September 26th, we have a class called Healthy Meal Planning Made Easy. So it's all about how to eat healthier. Once again, these are Wednesday nights, so it's September 26th. On October 24th, our next class will be Get Your Head Right, Handling Anxiety and Depression. And that'll be a lot of natural remedies that you can think about for anxiety and depression. And we don't have the topic yet, but will be announced soon. November 28th. That's the next one afterwards. We're not sure of the topic yet, but I just wanted to plant the seed. So last Wednesday of September, October, and November, we'll have classes as well. And we probably will take a break because it's Christmas around for December. We'll resume probably end of January. So you're welcome to attend, and we'd love to have you again. So tonight, we're going to talk about the role of chronic infection in chronic disease. And it's an area that's emerging right now because virtually all chronic diseases have chronic inflammation as part of their root cause. And so if we can quiet down inflammation, chances are we can quiet down some of the chronic diseases that we're hearing about and seeing today. And we'll go over a lot of these tonight. So we're going to be talking about, first of all, what is inflammation, first of all? What is it? How does it happen? We're going to talk about some of the diseases that are linked to inflammation. Then we're going to talk about some of the sources of inflammation. We're going to talk about some of the symptoms, lab tests that you can talk to either myself if I'm your doctor or somebody else who's your doctor, and also some of the treatments. And I particularly use natural treatments here because that's the emphasis of my medical practice. So we don't use a lot of pharmaceutical agents as our first choice, or maybe more of our second, third, fourth, or last choice. So we try to use more natural remedies here in this practice. And I've been doing this for over 30 years now. And I treat all kinds of illnesses, not just inflammation, but all the conditions you're going to hear about today are things that we address here in our practice. So what is inflammation? Well, first of all, inflammation is a defense mechanism within your body, within your cells. And so if you hurt yourself, you cut yourself, you fall off your bicycle, or you get injured in some way, your body needs to heal. And so inflammation is the initial stage that sets the cascade of healing. So it's not necessarily a bad thing. It's actually a healing event that can occur. The problem is if inflammation becomes chronic as opposed to just acute. Chronic inflammation is what leads to more disease. Acute inflammation is a healing response. So, you've all fallen when you're little, or your children or grandchildren may fall, and they scrape their elbow or their knee, and it's red and it's ugly, but over time that heals up. You get a scar eventually, and new tissue eventually forms. Part of that is due to the initiation of that inflammatory response that then stimulates the healing. So different pathogens, which are different organisms, can induce inflammation. Of course, you have a strep throat. Well, that induces redness back here, sore throat, difficulty speaking, because of the pathogen, which means the microorganism, such as strep, for example, can induce fever and pain and things like that. So just want to mention that inflammation can be induced by injury, pathogens, irritants. You walk into a room that's someone smoking, for example, or 10 people are smoking, you have trouble breathing, you start coughing. Well, that's part of the inflammatory response as well. So then we talk about the body's attempt to heal itself, to remove, first off, we have to remove the harmful stimuli. So if you have a splinter in your hand, obviously you have to remove the splinter. If that splinter there is going to cause swelling and pain and redness, and if you don't remove it, you're going to be in trouble. So the first step to reducing inflammation is reducing the causes of the inflammation. Obviously, you may have to do some detective work to reduce the cause of inflammation. So it's very important that we have an intact immune system. Our immune system has to be strong enough in order for us to mount that response to help heal the inflammatory response. Because there's various cells in our immune system, things such as what's called T cells and B cells and natural killer cells and cytokines, these fancy words that doctors use, but these are some of the different cells that begin to initiate the healing response for the immune system to mount a response. Chronic inflammatory responses can cause several different kinds of diseases. We'll take a look at those in just a few minutes. So chronic inflammation is very different from acute inflammation. Chronic inflammation is usually something that's lasting for a long time, and it's not going away so easily. It can last weeks, it can last months, it can last years. Whereas acute inflammation typically lasts a shorter period of time, and it gets better and usually resolves. So one of the first things we do, as I said, remove the offending causes, and chronic inflammation can also be caused by autoimmune diseases. Many of you have heard of like thyroiditis, autoimmune thyroiditis, or Hashimoto's thyroiditis. Well, in this example, an inflammatory response is occurring in your own thyroid tissue. Things like ulcerative colitis or Crohn's disease can occur in the gut and the bowels. Well, once again, this is due to an inflammatory response in the bowels. You've heard of things like rheumatoid arthritis. That's when there's an inflammatory response and it's chronic, occurring in the joints. So you can see how different organs, whether it's the joints, the gut, the thyroid, an inflammatory response can cause chronic disease within those organs. And so it can occur in any part of the body, really, when you think about it. If you're exposed to low levels of exposure to an irritant, whether it's cigarette smoke, but also could be what's called organic hydrocarbons, paints, shellacs, varnish, smoke, any of those things can also contribute to chronic inflammation. So depending on what organ is involved will determine maybe the outcome of what happens with chronic inflammation. So if it's in the brain, believe it or not, you can have chronic inflammation as if it's a fire in your brain, where you might get depression, anxiety, Alzheimer's, Parkinson's disease. All those are inflammatory responses, and it might, in this example, affect the brain. Or inflammation can affect, for example, the heart. What will happen if that occurs? Well, you might get blockage of the arteries. You may have high blood pressure. You may develop diabetes. The blood vessels can cause, if there's inflammation there, can maybe cause a stroke. So once again, depending on the organ can determine where the inflammatory response is seated. So first of all, I want some of the basic concepts regarding chronic inflammation. Is inflammation can occur, and it can underline virtually all chronic diseases. So you hear about people, deteriorating. Generally speaking, there's a lot of inflammation going on when that's happening. Cancer is a very pro-inflammatory disease as well. We'll talk about that a little bit. Inflammation is a major cause of the aging process. As we age, unfortunately, our body, the inflammatory process, there's many more what's called inflammatory markers that we can measure, generally speaking, as we age. And a lot of our cellular processes, our immune response, generally not as efficient as it was when we were younger. There's also something I'll show you a slide soon called mitochondria. These don't seem to function as well as we get older. And so the aging process absolutely involves more inflammation. And a dysregulated chronic inflammatory response can be caused, the major two causes can be diet or our lifestyle, and also, I should say, environmental stimuli, so maybe three big causes, really. But we'll talk about, those are some of the things we're going to be talking about here this evening. So I'm just trying to give you a little bit of background as to what, how inflammation may set in to different organs, and acute inflammation helps us heal, but it's a chronic inflammation that goes on and on and on that kind of causes chronic diseases and stimulates more of the aging process. So we take a look at some of the common inflammatory diseases. There's about 12 or whatever the number is here, 15 maybe, are some of the chronic ones. So rheumatoid arthritis, periodontal disease, hepatitis, so that's a liver inflammation, obviously. Chronic sinusitis, millions of Americans are taking different kind of antihistamines and decongestants for chronic sinusitis. It can be induced by allergies, by irritants, various things. If we think about asthma, millions of Americans have asthma, and they take inhalers, they take a lot of different medications, try to bronchodilate, dilate the blood vessels and the bronchi. Well, this is an inflammatory response too. This release of what's called interleukins and cytokines in an asthmatic that's in much greater amounts than someone who does not have asthma. Alzheimer's, believe it or not, is an inflammatory disease. Dementia, I mentioned depression earlier, but Alzheimer's for sure, they're showing now that there's many more inflammatory markers in someone who has Alzheimer's than someone who doesn't. And by the way, I'm going to show you soon, we'll talk about the gut a little bit soon, but there's a connection between inflammation in the gut, the GI tract, and how our brain functions, believe it or not. So there's a whole medical journal now dedicated to just studies and publications on the gut-brain connection. Believe it or not, obesity. So sometimes people don't have to necessarily eat more and more food to get obese. Sometimes it's due to inflammation that's occurring in their cells themselves. Once again, an inflammation can be induced by environmental chemicals, stimulants, irritants, lack of inability to detoxify effectively. And so it's not always just due to excess calories. It's probably the number one cause, but there are other contributing factors as well. But obesity has been shown that the adipose, which is the fatty cells, have been shown now to release many more inflammatory chemicals and compounds than someone who's slender and not obese. Diverticulitis in the gut. It's been well known to be a disease linked to chronic inflammation. And that's why they tell you, eat certain foods, avoid certain foods, because it's an inflammatory response that's causing the pain. And the diarrhea and the bloating and everything else that goes along with diverticulitis. Heart disease is one of the most common conditions that is induced frequently by inflammation. And that includes not just blockage of arteries, stroke, high blood pressure, certain what's called arrhythmias, which means irregular heart rhythm. All those have inflammation at some core within the physiology or the causes of those conditions. So, we have to think about reducing inflammation even for heart disease. And it's not just reducing cholesterol. It's the inflammatory response probably is more a culprit for some of the chronic cardiac diseases than cholesterol is, which I know the cardiologists may not completely agree, but they're starting to look at some of the inflammatory responses too. And so we measure those things in my practice, for example. When I see someone who has high blood pressure, or has diabetes, or has chronic, told they have blockage, or they need stents or bypass surgery, we often find it, I'm going to show you some of the markers in a minute, but that they have higher amounts of these inflammatory markers when we do laboratory testing. And so those need to be addressed greatly. Cancer and cancer metastasis is absolutely known to be something that's caused and spread, the metastasis, which is spread to other organs, can be induced by chronic inflammation. And so I believe, and many others believe, that if we're trying to protect a patient from a cancer metastasizing and spreading, we have to also address their inflammation. And so there's various inflammatory protocols that I use in my practice when I'm seeing someone with cancer to try to protect their cells so it doesn't metastasize. Diabetes is definitely a disease that involves great amount of inflammation as well. That's partly why diabetics sometimes have what's called neuropathy symptoms, which means like numbness and tingling in the legs, frequently in the feet, because there's so much inflammation going on at the roots, at the endings of the nerves. Okay, so it's not just because the sugar's floating around too high, it's that the sugar itself is inducing cellular changes. And these cellular changes are contributing to metastasis, to inflammation. Ulcerative colitis and Crohn's disease, which are GI problems, gastrointestinal problems, also has been shown that much more inflammation than people who don't have these things. By the way, and anytime you see in medical readings the word or the suffix itis, I-T-I-S, by the way, that means inflammation. That's what itis means. So whether it's gastritis, sinusitis, colitis, it all means inflammation of whatever the rest of the word was. All right, so let's take a look at some of the different, so essentially, your different parts of the body can be affected by the inflammation, and you can see here, the kidneys can get inflamed because of the inflammatory cytokines. They restrict blood flow to the kidneys. It can contribute to the hypertension, high blood pressure, but also nephritis and edema, which means swelling. If you take a look at even the GI tract, we mentioned colitis, but also even things like GERD, which is gastroesophageal reflux disorder. Some people take a lot of medications for those things because of acid reflux. Well, that's an inflammatory response. And so if we kind of switch to an anti-inflammatory based diet and lifestyle, sometimes these conditions can clear up. So it's not just because you have a deficiency of Zantac or some of the different medications out there today. It's because we have to get the root cause of these things to help reduce the inflammation. The lungs obviously can get inflamed. I mentioned asthma, allergies too, because it can cause bronchoconstriction when there's too much inflammation, which means a narrowing of the bronchi, the lungs. Thyroid, you can get autoimmune thyroiditis. The bones won't heal well if there's too much inflammation because there's too much swelling. And even with osteoporosis and osteopenia, which is a loss of bone mass, they have also been shown that they have a higher amount of inflammation as well in people that have that condition. A lot of people as we get older have osteoporosis and osteopenia. Those are inflammatory conditions as well. Muscles, you can get arthritis pain, you can get what we call fibromyalgia, you can get myositis. Pain in general, most pain syndromes can be induced because as a result of chronic inflammation. So whenever there's pain in the body, you have to think about inflammatory responses and what can be done for that. Cardiovascular disease I mentioned, and brain I kind of mentioned already. So once again, Alzheimer's, Parkinson's, even multiple sclerosis, there's more inflammation in those individuals. And I mentioned anxiety, depression too. So virtually any part of the body can be affected to cause cellular inflammation. So we look at some of the common sources of inflammation. So I mentioned food. We're going to soon talk more about food, but excess alcohol intake can certainly cause inflammation. You hear about people getting gastrointestinal bleeds if they drink too much alcohol. Well, that bleeding is due to inflammation of the blood vessels in the GI tract. Environmental pollutants. By the way, there are over 85,000 chemicals that are in production today in our society, and it keeps going up and up every year. And many of these environmental chemicals aren't so terrific for us. They can be different industrial pollutants. They can be plastics, parabens, phthalates, paints, shellacs, varnishes, pesticides, herbicides. You can go on and on and on. Flame retardants, heavy metals, all those kinds of things contribute to inflammation. There's plenty of literature now showing that excess, like air pollution, can contribute to heart disease, can contribute to cancers, of course. So we have to think about environmental pollutants, foods in general. More that if you char a food, especially let's say it's a piece of meat and it's charred and it's burnt, that's really a problem because those have more inflammatory chemicals within them. Red meat can be a culprit frequently. Fried foods, also it's not there, but trans fats, which are found commonly in margarines and in various bakery products. They contain a lot of trans fats, which are unnatural fats to our body, and our body doesn't know how to handle those things because they've never been seen in nature ever. They're sort of synthesized things. So all these things can cause excess cellular inflammation. Viruses and bacteria. So you've all heard of Epstein-Barr virus, I think, by now, and so unfortunately, most of us have had some exposure to it at some point in our lives, but that's just one little example how of a bacteria that can cause inflammation in the body. You've heard of the HPV virus, and that can cause inflammation and can lead to cancer in some cases. But things like salmonella, you can get stomach infections from that, from our food supply if it gets into the food. Chlamydia, strep, E. coli, these are all different bacteria. Even Lyme disease, but Lyme disease, if it gets so severe, can cause neurological Lymes. It can cause inflammation in the brain, and people don't function well if that occurs. So that's why you have to try to treat it in an early stage. Most of these conditions you have to treat in an early stage. Shingles, some of you in the room probably have had shingles at some point. Well, that's an inflammatory response. It's usually people can get rid of that most of the time, but if it lingers and lingers and lingers, it turns into a chronic condition and is very, very painful. The initial, if you get rid of it after 1, 2, 3 weeks, usually people are fine, but if it continues for months and months, it's a very painful condition. But once again, that's caused by inflammation of the herpes, of a cousin of the herpes virus, basically. So viruses and bacteria are known to contribute to chronic inflammation. Various stressors can also play a role in environmental things that can cause stress. If people are getting chemotherapy, that causes great amount, and so does radiation, great amounts of inflammation. So if we have a patient in my practice who's getting either of those two treatments, we try to put them on an anti-inflammatory program at the same time to help protect their cells. Because that inflammation that might be induced by chemotherapy, for example, or radiation that's killing maybe the cancer cells, but it causes that dead tissue to be very pro-inflammatory. So part of the treatment should be to protect those patients by using various anti-inflammatories that work in conjunction with chemo and radiation, so that it doesn't cause as much problems and it hopefully won't cause metastasis. If we give chemo radiation that's causing too much inflammation, it can contribute to a spread of the cancers. So that's why we need to block the inflammatory pathways, even for someone who's getting these kinds of therapies. Okay, now, our gut, our GI tract, can play a very important role in inflammation too. And this is an emerging area over the last 5 to 6, 7 years in medicine, that they're finding that the microbiome, which means the balance of the bacteria in our GI tract and our gut, is so important. And it turns out that every one of us in this room is actually more bacteria than we are human. Now, what do I mean by that? Well, it turns out that there's about 100 trillion bacterial cells in our GI tract, and they're communicating with each other, they're sending messages to each other. There's a whole environment, an ecological world that's existing in our gut right now. So there's about 100 trillion of these cells. But yet, we only have about 10 trillion human cells in our body. So we're actually about 10 times more, we have 10 times more bacteria than we have human cells, by the way. And they're extremely important. They're not benign. And unfortunately, we disrupt them, we destroy them, and they cause a lot of inflammation if we don't handle it properly. So some of the things that can damage our gut flora commonly are antibiotics. Especially young kids, when they get sick, doctors put them on antibiotics first thing, and we need to slow that down greatly. And even as adults, of course, we shouldn't be taking those very frequently. Birth control pills disrupt the normal flora, normal balance. Steroid medications, prednisone and other corticosteroids, can also disrupt the normal balance. Excess alcohol can, poor diet, all these things are much, much more. Even anti-inflammatory drugs, such as naproxen and ibuprofen drugs, they actually cause some damage to the lining of the GI tract, and they disturb the normal balance of the bacteria. So it's an area that's gaining a lot of recognition. There are thousands of studies that are being done now and published looking at the link and the connection between chronic inflammation in the gut and many, many other chronic degenerative diseases, including brain conditions as well, and much more than that. So there's ways that we try to repair the gut so that that chronic inflammation does not continue. There's ways we assess the gut, by the way, as well. Once you assess it, it's easier to target a treatment plan. Another area is food sensitivity. So many people, some know it, but some people don't know that they may have food sensitivities. And these food sensitivities can cause cellular inflammation as well. And so think of, if you get stung by a bee out, in your hand, your hand's going to swell. But by the same token, if you're eating, let's say you're sensitive to wheat or dairy products as an example, and you're eating that, ingesting that, well, those foods can cause also swelling in the GI tract. And once there's swelling, it causes, it can cause chronic inflammation. So we do a lot of evaluations for food sensitivities, and food sensitivities can cause almost any symptom you can think of too, whether it be headaches, joint pain, depression, anxiety, obesity, GI symptoms. They can, doesn't mean they always do it, but I'm saying they can cause every one of these symptoms and much more. So it's very important that when somebody has a chronic condition of various sorts, that perhaps we, after taking a thorough history, that we take a look, do they have food sensitivities, and what can we do about it? And by the way, it's very important that your dentist takes a very thorough look at your teeth, your gums, your mouth, because those are areas too that are often neglected, and they can cause a lot of inflammation and therefore systemic diseases. You can get chronic inflammation in your gums and it contribute increased risk of heart disease, for example. There's different meridians in our teeth, for example, when people have root canals, and there's, I think it's the upper left somewhere, where there's a connection between that and possibility of increasing risk of breast cancers. So we have to think globally here. We have to start thinking, what are the causes of the diseases we're getting before we can target them effectively. So we have to limit those foods, or eliminate completely if you can, foods that we are found to be allergic or sensitive to, or perhaps intolerant of. You've all heard of celiac and gluten sensitivity, but you could be sensitive to other foods as well. It could be corn, soy, eggs, wheat, all those kinds of foods. For one individual, may be totally fine, but another individual may be very troublesome. So that's also, if someone's having a chronic abdominal pain, bloating, gas, these discomfort in the GI tract, I think it's very important that we take a look for food sensitivities. Now, I briefly mentioned the term mitochondria, and this is something that is also getting a lot of recognition in medicine today, and it's an area that I put a lot of emphasis on in my practice. And we have thousands of these little tiny microscopic things in every single cell. They're called mitochondria. And they help produce cellular energy. If the mitochondria are not working well, they're not making enough energy, our cells can die off. And when this happens, when there's not enough energy produced, it's called ATP in the mitochondria, there's more inflammation going on within those cells. So having healthy mitochondria is very, very, very important. These mitochondria also can help not only to help with cellular energy, they protect what's called from DNA damage. They also help maintain normal glutathione levels, which protect our cells in regard to detoxification and getting rid of chemicals and pollutants and pharmacologic metabolites. When you take a medicine, no matter what it is, your body has to metabolize and get rid of it. If you hold on to it too long and you can't get rid of it, your body's going to become toxic over time. And so one of the very important things is to try to make sure your detox pathways are open, and your spleen and your liver and your colon and your intestines are all working very, very well. But anyhow, so the mitochondria are very important. They activate various normal cellular processes, and we find that as we get older, as we have chronic diseases, that the mitochondria don't work as well. And when that happens, it causes a heightened inflammatory response. So this is another area that I think is very important to pay attention to. The next area that I want to mention is if someone has high levels of insulin. So those people, adult onset diabetics, often are producing too much insulin, not too little, but their body is what's called insensitive to it, meaning their body, it doesn't work well. The body doesn't know how to utilize it well. So excess insulin can be induced by eating too much sugar, processed refined foods, obviously. Anyone in this room do that? Of course, we all probably do to some degree. But it turns out that 20% of the American calorie intake is due to simple sugars, white sugar, refined sugar. And about 50% of our calorie intake in this country is due to processed refined foods in general. So we're talking about 70% of our diet has very, very little value. And on top of that, chances are it's going to increase the insulin secretion from our pancreas. Well, what happens if the insulin is too high? So all these different things can increase when our insulin levels are too high. So, see, now my inflammatory response, my acute inflammatory response. So by having too much insulin, it stimulates inflammation in the body. It's a very pro-inflammatory hormone, insulin. And that's why also diabetics frequently have much more heart disease. They have increased risk of the neuropathy symptoms and nephropathy, which is kidney problems, and all kinds of things because of the inflammatory responses that's triggered by the insulin. It also is going to trigger more high blood pressure. It's going to increase lipid levels, such as cholesterol and triglycerides, and also the bad cholesterol stuff. And also it's going to impair the ability of the liver to detoxify if you have too much insulin in your body. There's going to be much more what's called oxidative stress, and it's going to impair normal secretion of testosterone and estrogen as well. So, and what happens is men start making more estrogen, so they start looking more like women in a sense, and women start making more testosterone, which makes them a little bit look like more men. So that's all part of the excess insulin secretion, which is setting up a whole cascade of inflammation, and that often is induced by our lifestyle and our diet. As we gain weight, insulin levels go up. If we don't eat healthy foods, the same thing happens. So let's take a look at some of the symptoms of inflammation. And there is a difference between, as I said earlier, between acute and chronic inflammation. But if we think about acute inflammation, such as I just hit my elbow a moment ago, so there's an acronym, thank you for that, and it's PRISH, P-R-I-S-H. And what does that mean? Well, it means pain, redness, immobility. You may not be as flexible if you have pain, obviously. You may have some swelling, and you may have heat. So when a doctor examines a patient who, let's say, hurt his or her knee, for example, he's going to palpate, he's going to feel it. The patient may complain of pain when he's palpating and pushing. There might be some redness, possibly, if it's acute inflammation. It's called erythema. They may be less mobile. When we move the knee back and forth, they might say, oh, I can't straighten it out, it hurts too much. And that hurts partly because of the swelling there. And then there might be some heat. If you feel there might be some temperature changes compared to left knee versus right knee or whatever. And that's another way of helping to assess on the physical exam about if there's acute inflammation. What about lab tests? So there's a variety of lab tests that can be offered. These can all be done by standard reference labs, although I'll tell you that the last two on this list are not as well known to most physicians, but it's something that's emerging now, and I've been using these for many, many years as part of our assessment. So when I see someone with most or almost any chronic disease, we take a look to assess the inflammatory pathways, because I think that's really important. So we look at, first of all, what's called the SED rate. It's also abbreviated ESR. It stands for erythrocyte sedimentation rate. Normal is less than about 20 by most labs. And you know, people with rheumatoid arthritis, people with various cancers, for example, and some people with thyroiditis, you'll see that these levels can be 30, 40, 50, 60, 70, and sometimes higher. So the SED rate is a simple test that any doctor can order for you through his reference lab, and that's one objective, one measurement. By the way, everything I'm talking about today, this is just an overview of things. There are even more lab tests that can be done, and there's more of everything that can be done. But in a short period of time, we're just giving you an overview. The next test we often measure is called CRP. It stands for C-reactive protein. It's a protein that's secreted by your liver and other cells in the body. There's both a total amount, or I guess you call it non-specific, but there's also one called highly sensitive, or cardiac CRP. That one's a little bit more indicative of future potential events for cardiac events, such as heart attack or stroke, if you get this highly sensitive CRP. But a total CRP is used more commonly for other, just assessing general inflammation overall. And for this, if it's a highly sensitive CRP, which is also called cardiac CRP, you want it less than 3, and ideal is less than 1. By the way, all lab tests have, quote, a normal range, but they also, I think you should view it as not just normal, but is it optimal? Is it ideal? And I think, it's something that I look at personally. And most doctors, they'll just say, oh, it's in the normal range, you're done. Well, but if your CRP, if you're highly sensitive CRP, is it 2.9, they may tell you you're normal, but I'm going to tell you, well, you know what? You're creeping up into an area that might be abnormal, and we want it more optimal, such as 1 or below. Serum ferritin is a storage form of iron, but if the body has too much iron in it, it can be a pro-inflammatory marker as well. It can induce a lot of what's called cytokine release, which are inflammatory chemical compounds that we make in our body. We all do need iron, but too much iron is not a good thing either. It can induce what's called oxidative stress to our cells, and oxidative stress is something that induces inflammation. If you think of, for example, a nail, buy a brand new nail at the hardware store, and you put it outside. Over time, that nail, especially in the rain and moisture, is probably going to rust. That rusting process is due to oxidative stress. And that same thing happens to humans for a variety of reasons. Our diet, our lifestyle, too much sun exposure, too much radiation exposure, too much of anything probably is not so great sometimes. But in general, serum ferritin, if it's too high, it's not a good thing either. Hemoglobin A1C. How many of you have heard of that one? Okay, good, about half of you. So that's a reflection of your blood sugar over the prior 3 months or so of time. And if that's high, like cutoff's about 5.7, so if it's a little higher than that, you might be pre-diabetic. If it gets above about 6.1 or so, 6.2, they'll probably say, hey, you're diabetic. So this is a good marker because it means chances are you're not handling that insulin that I showed you earlier, not handling insulin very well. And you might be pre-diabetic if it's 5'8" to 6'1", let's say, 6 point. And so it's time to you better make a change in your lifestyle, your diet, your exercise, and everything else. So these are good markers, to get assessed, because if things are starting to creep up, you need to act upon it now so you don't develop a chronic degenerative disease later on. Fibrinogen, this one you may not have heard of so much, but it's also something that when fibrinogen levels are high, people are more prone to abnormal blood aggregation, clotting of their red cells in particular, red cells. So when these cells clot too much, there's a lot of inflammation that can occur. And you can see this in various forms of heart disease, in some forms of cancer. So when it's high, above about 425 or so, it's a sign that there's probably too much inflammation going on in the body as well. Now, the next one together it's called interleukins and cytokines. And so I do a lot of work with immunology and taking a look at the immune system. And there's a lot of inflammatory cells that, besides the first few that you can measure, and some of these are called interleukins and cytokines too, but there's at least 10, 15 different interleukins that may be important, that can be looked at, but some in particular, called interleukin 6, interleukin 8, are very pro-inflammatory. So I do look at these periodically, especially in my cancer patients. I look at these regularly because we want to make sure those things are kept at bay. And there's things we can do to keep them down as best we can. But it has a lot to do with, once again, with the lifestyle and diet of the patient. And the last one I have here, a lot of doctors are still haven't heard this one, but they should. And it's called galectin-3. And galectin-3 is known as a lignin. It's a very complicated structure of a protein that when it gets too high, and typically when it's below 17.6, but when it gets too high, it usually is indicative of great amounts of inflammation in the body. And it stimulates another inflammatory marker called NF-kappa B, which is sort of the inroad for so many of the other inflammatory pathways within our bodies. So this has been associated with weakening of heart muscle, people with what's called cardiomyopathies, for example, where the heart doesn't pump as well. They often have high levels of galectin-3. People with various fibrosis conditions, scleroderma, for example, and various other fibrotic conditions and some autoimmune conditions, they often have high levels of galectin-3 because it's stimulating so much inflammation through this NF-kappa B pathway. People who have cancers, especially if they've had metastasis, this is another one that's very high, and diabetics can have high levels of galectin-3. So all the standard labs are now measuring all these things, but I will kind of warn you that your doctors may or may not be completely familiar with the last 2 or 3 of these. They will be completely familiar with the first 4 of these, by the way. And some of you may have these done. So, what do we do when we have excessive inflammation, both through physical exam, through laboratory work, through a chronic disease? Well, obviously we have to address these situations. So we're going to talk, the next section will be 4 major areas that we'll mention, and we'll talk about some of the foods to eat, some of the foods to avoid. We'll also talk about some of the herbs and spices that might be considered, various plant-based, plants themselves sort of, and then different supplements, which I think are very, very important. So we're going to go through these sections next. So, in general, real food is best for you. What is real food? Food that comes from the planet Earth and doesn't come from a factory, and doesn't come from a bakery, and doesn't come from a manufacturing plant. In general, that's a rule of thumb. So if you can eat real food, so that's certainly going to be best. So fruits and vegetables and nuts and seeds and green leafy things, maybe some fatty fish, olive oil, tomatoes. These are just general, and I'm going to go over some of these in detail in a second. And things to avoid, which contribute to increasing inflammation, obviously are things like lard and refined carbs and sodas and fried foods and processed meats. So those things should be avoided as best as possible or greatly limited. So if you have children or grandchildren, try not to have them drinking sodas. There's nothing healthy or beneficial about sodas that we drink in this country. I was at a store, it'll go unnamed, yesterday because I had to buy some car wash stuff. But anyhow, I was amazed. A lady was buying, literally, she must have had 50 bottles, but the big ones, were they 2 liters? Yeah. 2 liters of sodas, Frescas and Pepsi and Coke in her cart. And I was like, I mean, it was literally 50, had to be. It was stacked 100% just with sodas. So I happened to park next to her. So I was putting my stuff in the car, she was putting her things in the car. And I said, what are you having, a big party? And she said, no, I own a restaurant, actually. But point is, I mean, people are drinking this stuff. And, 6 ounces of a soda, Pepsi, I don't mean take home Pepsi or Coke, but it's any of it really, contains approximately, depending which one, about 10 teaspoons of sugar per about 16 ounces. So you're loading yourself up with something that's going to suppress your immune system, that's going to increase your insulin secretion, it's going to stimulate more inflammatory pathways, has no fiber, has no beneficial vitamins, minerals, amino acids, essential fatty acids, or anything like that. But Americans do it. And then they wonder why they're sick later on. Anyhow, so this is just some of the things that I've written down through my experience, being here for the last almost 32 years. What to avoid in general. And first of all, we have found that a lot of people are very sensitive to wheat products and wheat itself. About 50 or 60 years ago, wheat was what's called hybridized and modernized in this country. And the seedling of wheat was actually changed. And it used to grow to about 5 or 6 feet tall, and now it grows about 2 or 3 feet tall because it's been changed. They used to use a different seed called, I think it's called einkorn seed, and it's not used much in this country anymore. But it's become very pro-inflammatory as a result. People often ask me things like, well, should I eat a gluten-free diet? And I often tell them that just because something is gluten-free doesn't mean it's necessarily healthy. Because you can buy muffins sometimes that's gluten-free, but it might be loaded with sugar and other substances to make it more palatable. That's not really so great for us either. So I'm not saying never eat these things, but just limit your wheat intake if you can. And especially if you're sensitive to it. If you have no problems with it, maybe you can get away with that. Dairy products are not the greatest, even though the pediatricians will tell your children to drink milk, and the advertisements on TV. They're also very pro-inflammatory because we're the only species and only mammals that drinks and eats milk products from another species. We're the only species that eats and drinks milk products after being weaned. And the percentage of proteins and fats in human milk is very different from cow's milk. And so there's a lot, and it can also contribute to a lot of autoimmune diseases too. There's been some speculation of maybe increasing risk of diabetes in our society, especially type 1 diabetes, by drinking all the milk that we tend to drink. So once again, be careful. That's all I'm saying. I'm not saying never have these things. But if you have a pro-inflammatory condition, you might want to try, like just for your own experiment, like a 1-month anti-inflammatory based diet. And then these are some of the things that we tell you to eliminate if you can. So it's wheat, dairy, simple sugar, refined sugar. I'm not talking about berries, strawberries, raspberries, blueberries. They're okay most of the time. But I'm talking about refined simple sugars. Processed foods, and I already said that about 70% of our diet is processed food and simple sugars. And in some individuals, especially if you have like arthritic conditions, we have found, and it's been documented by Dr. Childers, that the nightshade foods may be troublesome for some select individuals, not everybody, but a subset of people with arthritis. And nightshades are foods that typically grow at nighttime. They grow better at nighttime. And it tends to be tomatoes, eggplant, peppers, and what is it? I'm missing. Potato, white potato, thanks. So it's potato, eggplant, pepper, and tomatoes. And tomatoes, I think, are really, generally speaking, these foods are really good for us overall. But I'm saying for a select subset of the population, they may not be so good, especially if you have a lot of joint pain and arthritic aches and pains. So, by the way, we're all individuals, and I don't think we should generalize. We should generalize from one person to another. We do too much of that too, and you might find that these foods are not troublesome at all. But I think it's worth, if you have an inflammatory condition, if you want to try it for a month, see how you feel. You might say, hey, no change at all. Okay, that's fine. Now, some of the other highly allergenic foods or sensitive foods that people eat, that we eat a lot of is soy, first of all, eggs, and corn. So these are just some of the things that I tell people, hey, look, try an elimination diet for a month, see how you feel. If they feel better, we might continue them on that type of thing, or they might add some of this back slowly to see how they feel. So these are the main, now we'll talk about some of the foods that you should be eating in general. So all these categories of foods are loaded with antioxidants. They protect our cells from breakdown, they protect it from inflammation, and it's a lot of plant-based foods. Now you can have, I'm not saying don't have any animal protein, but lean towards 80% of your diet, if you can, of plants. So it's basically fruit, vegetables, beans, legumes, nuts, and seeds. Now, obviously everyone's different. Some will say, oh, you should be vegan 100%. And I'm not getting into that today, but just, my blanket statement would be try to lean towards eating more plants. We don't eat enough plants in our society, and especially these categories right here. If you take a look at some of the best anti-inflammatory fruits are berries, and they have a very low what's called glycemic index, which means they do not turn to sugar very quickly, so they don't cause a lot of inflammation at all. In fact, they probably block and inhibit inflammatory pathways. So it's blueberries, strawberries, raspberries, blackberries, and if there's any other berries, you should eat them too. So those are all good for us. By the way, the more you buy organic, the better too, and I didn't mention that, but if you can get organic fruits and vegetables and everything else, it is better because they're not as sprayed and chemicalized. And anyhow, anti-inflammatory vegetables, anything that's colorful is generally good. The more pigmented a vegetable is, generally speaking, the better it might be for us. So all the green vegetables, kale, spinach, rhubarb, cabbage, asparagus, Brussels sprouts, they're all loaded with antioxidants and what's called sulforaphane and phytonutrients, and they help block some of the inflammatory pathways. They can be juiced, they can be put in smoothies, they can be steamed. You can eat these in various ways, and you probably should eat foods in various ways so it's more interesting, doesn't get as boring, and some foods are better, one way or another, so mix it up. Mushrooms are terrific for us, by the way. They're very high in what's called beta-glucans. Peppers are one of the highest, they have one of the highest antioxidant potential of any foods out there. Yellow, orange, red, green peppers are all good for us. And Gina will tell you what I sometimes eat for lunch. Well, it's not the whole meal, but she laughs at me because I often bring a whole pepper in. I like the yellow ones. And I often bring a whole yellow pepper and I'll wash it off and I eat it almost like an apple. I don't eat the seeds inside, but I eat the whole exterior. Just take it in my hand and start munching away at it. And they're loaded. It's called the, I can't think of the term right now, I'll think of it later. ORAC score. There's a score that's done in research, the research world, to measure the antioxidant potential of various foods. And peppers are one of the highest in something called the ORAC score, which means it has some of the best antioxidant potential, which helps block inflammatory pathways. Onions, garlic, artichokes, beets, they're all good. They're all good. There's very few, and sweet potatoes and yams, squash. There's very few vegetables that people would say, hey, not good at all for you. They're generally pretty good for you. And beans and nuts, beans and legumes, very, very good. So lentils, chickpeas are high. All these beans are very high in fiber. They're high in protein, and they have great amounts of phytonutrients too. Phytonutrients are nutrients in there that help block the inflammatory pathways and help improve cellular function in general. So kidney beans, pinto beans, aduki beans, green beans, all beans are good for you. And for those people who are leaning, a lot of people who are eating more vegetarian, they say, where am I going to get my protein from? Beans are a great source of protein as well.
What about black beans?
Black beans are terrific. They're all good. Thanks. Nuts. So almonds and walnuts are two of the better ones because they've been shown to be very good for diabetics, very good for people with high blood pressure, people with high cholesterol. They've done studies eating 1 to 2 ounces a day might help to lower blood sugar and cholesterol and blood pressure. Other nuts are here too. You can use those as well. Also very high in fiber and block a lot of the inflammatory pathways. Take a look at seeds. You should sprinkle these onto your salads and put them into various places. There's smoothies. You can throw a little flax or chia seeds in as well. Hemp seeds are good. By the way, quinoa is actually a seed, even though we think of it sometimes as a grain. It's actually a seed. But Quinoa is very easy to make. It's kind of, has anyone here not made quinoa or not had quinoa? You'd have. So anyhow, it's a very fluffy, light, looks like a grain, but it's a seed. Not hard to make, very easy. And it looks like sort of, it's light and airy, like a rice, sort of, but a fine rice. And try it out. It's very healthy, very high in protein. It's a great alternative source of protein. Very good source of fiber as well. Sunflower seeds, pumpkin seeds, sesame seeds, pomegranates are real good. So even eating the real pomegranate, getting the real pomegranate and eating the seeds inside there are terrific for you. And they can be a good nighttime snack. So if you're watching TV or reading the paper or talking to the kids, and you're like want to munch on something, pomegranate seeds are really good to munch on it if you want. Turn your hands a little bit red temporarily, just wash them off afterwards. But just saying, they're really good for you. They may fulfill some of your sweet cravings for some of you, and they don't have a high glycemic index either. So keep those in mind. Now let's take a look at some of the beneficial herbs and spices. These are more cooking and various things. And by the way, in other societies, in India and in Asian countries, they do use way more herbs and spices in their foods, as you know, than we do. But let's take a look at a few of these. So the one I like probably the best, even for medicinal purposes, is curcumin. There are over, I think it's up to like 4,000 published papers on the benefits of curcumin in what's called PubMed, which is like an online source of medical publications that doctors, well, my kind of doctors look at, as far as curcumin. So curcumin is one of my go-to guys. It is extremely anti-inflammatory. It's excellent for arthritis. It's great for GI colitis and diverticulitis. It's very good for rheumatoid arthritis, heart disease, cancer. There's very few inflammatory conditions that curcumin may not be beneficial for. Now, I'm not going to tell you that it cures everything, or for that matter, cures anything, but it helps to reduce the inflammatory pathways that are inducing the swelling, the pain, the redness, and everything else that's occurring when we have inflammation. Curcumin contains something called piperine, and when it's combined with black pepper, it's even more, supposedly like 10 times even more potent than if either are used by themselves. So it can be used in a food. Many of you seen turmeric, and you can use that in your foods. You can use it in a smoothie if you'd like. It's the golden color that you see in some like Indian food, for example, but you can use it as well. And curcumin is the most well-studied component within turmeric. There's many components in turmeric, but it's the curcumin that may have the most powerful effect of all, the beneficial effect. And we have it also in supplement form, and we use it in a lot of our patients all the time. The next one I want to mention is ginger. Of course, ginger is terrific to soothe your sore throat. It's very good for arthritic aches and pains. It greatly reduces inflammation. It contains something called gingerol and zingerone, which are two of the major components that are responsible for its anti-inflammatory effect. You can buy fresh ginger. You can buy it in capsule form. It's also very good for nausea, especially when a female may be pregnant. We sometimes recommend ginger capsules for that individual. You can make ginger tea at nighttime or daytime if you want. But anyhow, it's very anti-inflammatory, and it's been beneficial for people with kidney troubles, people with diabetes, people with heart disease, and cancer patients as well. The next one is cinnamon, and cinnamon tastes good. I think it tastes good. It's loaded with antioxidants and phytonutrients. It inhibits some of the proteins that contribute to inflammation, and so you can put cinnamon in your coffee if you wanted to. You can buy the cinnamon sticks and put it and sprinkle it if you want into your foods. Diabetics do very well with cinnamon, by the way. It also comes in capsule form. Black pepper I briefly mentioned, but it contains something called piperine, and that's the component that makes peppers hot. But anyhow, it also has been shown to be very good to help relieve symptoms of arthritis, and when combined with curcumin, it's even more powerful. So some of these herbs and spices can work synergistically together, and it's totally fine. And so green tea, there's tons of world's literature on the benefits of green tea. You can buy it obviously as a tea. You can also use it in capsule form. We use it a lot for various forms of inflammation, heart disease, cancer, diabetes, high blood pressure. There's literature on all these types of things that it may help reduce the inflammatory response within these conditions. Can't hurt you too much at all using green tea. You can drink 2-3 cups a day if you could. The next one I want to mention is rosemary and then sage. They're very similar in some ways. They have similar flavors. Rosemary also contains certain compounds called rosmarinic acid that helps to, they use it as a preserving agent in certain foods. But anyhow, both of these can be very helpful to protect the body from inflammation. The next area I'm going to talk about is some supplements. So there are 4 supplements that I'm going to call my fearsome foursome, and we have these available here tonight too if you're interested. But anyhow, so these are the 4, and I kind of briefly mentioned curcumin because it's one of my favorites. The other 3 will be other things that are, you may not have heard of these other 3. And we'll talk about what these are. But one's called Quail, one's called Pectus LC, and the 4th is called molecular hydrogen, which the product that we have is called H2 Absorb, but the generic name is called molecular hydrogen. So if we take a look at curcumin, it's a great anti-inflammatory. It interferes with the metastasis of cancer cells. It interferes with something called the cancer stem cells. It enhances the effect of chemotherapy. So it actually enhances the beneficial effects of chemotherapy. It also reduces the side effects of chemotherapy. So that's just one area. And people with, I mentioned, heart disease, arthritis, diabetes, I think that curcumin should be considered greatly. The other cancers, I should say, are specifically, there's a lot of literature about prostate, breast, colon, liver, esophageal, and oral cancers. It's been a great benefit to a lot of these types of conditions. Quail is a product that we have here too that contains it's a combination of things. And it contains some curcumin, but it also has black tea extract. It has NAC, which is N-acetylcysteine. It has some vitamin E and trans-resveratrol, which resveratrol is also one of my favorite type of nutrients, which is derived typically from red wine and from grape seeds and from the skins, and also from the skins of various berries. And it has a very protective effect to block inflammation. In Quail, we've used that to block when I see high levels of these inflammatory cytokines and interleukins. We often put them on Quail, and we've seen some very, very impressive results. It's been used to reduce fatigue, reduce fibromyalgia, and various other chronic conditions that are pro-inflammatory. The third one that I like a lot is something called Pectus LC, which is this thing here. It can be a powder, or we have it in powder. It can be a capsule too. But anyhow, so this is something that been very effective for blocking this thing I mentioned called NF-kappa B. So when the galectin-3 is high, that's a blood test that I mentioned that we do through our lab, we need to block that galectin-3 because that galectin-3 can stimulate a very pro-inflammatory initiator called NF-kappa B. So one way of blocking this galectin-3 is to use Pectisol. So Pectisol has anti-inflammatory effects. It reduces fibrotic conditions. It helps to reduce toxins, including heavy metals in the body. It also blocks metastasis. It also helps to reduce what's called abnormal angiogenesis. So when there's abnormal blood supply, abnormal capillaries in blood supply going to a tumor, for example, you want to block that. This is one of the better things that can block that, and it blocks tumor progression as well. So, and it does some very important things, which basically it helps the immune system to fight things much better. And it has the one we have is a lemon lime flavor. It tastes fine, and I think that's really important because we're all exposed to so much toxins today and so much inflammation. It's a nice thing. You just put a little scoop of it in your water every day, stir it up, and you just drink it when you drink your water. The other fascinating thing that I came upon about 7 or 8 or 9 years ago is called molecular hydrogen. So this is something I'd never heard of before, and I was so impressed. I've gone to 3 lectures on it, or maybe 3 or 4 so far. And if you're interested in reading more about this, there's a website called molecularhydrogenfoundation.org, and they have over 700 what's called peer-reviewed medical journals, specifically on the beneficial effects of this molecular hydrogen. And what it does, well, let me back up. When we have pain, when we have chronic diseases in our body makes much more of what's called the hydroxyl radical, which is OH minus. And what this molecule does is it actually binds the hydroxyl, which is a very stressful pro-oxidant molecule that's made in our body when we have disease. And it binds it, so you have OH minus plus this H2 thing from the molecular hydrogen, and it turns this hydroxyl thing into water. So it neutralizes a very potent pro-oxidant and turns it into water, which is, I think, it's tremendous. So it has antioxidant effects, has anti-inflammatory effects. It also can improve your lipid, which is your blood cholesterol control, and your glucose control. It has very, very benefits to it. And I think their website mentioned it has there's studies for 130 different conditions for which molecular hydrogen may be beneficial from a clinical standpoint, which is pretty good. And it's totally harmless. By the way, everything, the four that I just mentioned so far, completely harmless. I mean, I wouldn't tell you to swallow the whole bottle unless you get a stomach ache. But if you use a scoop or two of it every day, you shouldn't have problems with it. And the same thing with the molecular hydrogen. We use one tablet, some people use 2 tablets. But 1 tablet a day is a preventive measure. It won't have any adverse effects. Curcumin, I mean, by the way, for curcumin, there's studies being done at, that's great. Studies being done at University of Michigan by Dr. Max Witcha. And he's using anywhere from 6 to 8 grams a day, which is a lot, of curcumin to help treat many of his cancer patients and getting very, very good response with it so far. So, so once again, all 4 of these have potent anti-inflammatory effects, and I think that they should be greatly considered into an anti-inflammatory program. There's various others that, you could talk to someone else. There could be another 20 different things that may be beneficial. But I just want to throw out another 4 quickly. One is vitamin D. Now we see that vitamin D deficiency, or what we call suboptimal vitamin D, occurs probably in 70 to 80% of our population in this country, which is huge. And low levels of vitamin D have been associated not only with bone troubles, but with multiple sclerosis, with Parkinson's disease, with various forms of heart disease, various forms of cancer. So I think it's really important that we take a look at our patients' vitamin D levels and hopefully get it into an optimum range. So unfortunately or fortunately, the range is 30 to 100, but the unfortunate part is if you're 32, many doctors will tell you, oh, you're fine. Well, I don't believe in that, and I tell my patients, look, you're at 32, but optimal is generally about 60 to 70 depending on the condition. And so if we push you up from 32 to 100% greater and we get you up to 64, you might function at a much better level. So a low level of vitamin D has been associated, as I said, with various inflammatory conditions, even things like the flu in the wintertime. A lot of people do well, just start taking vitamin D in the wintertime, and they're at much less risk for getting colds, infections, and flu-like symptoms. But if you're going to take it, it may be important, depending how much you're taking, to have your doctor monitor your levels periodically. Glutathione I like a lot. Glutathione is what's called a tripeptide. It's 3 different amino acids linked together, but it also is something that helps us greatly with the detoxification pathways, has a great antioxidant potential, and also helps against inflammation. Coenzyme Q10, some of you have heard of that one, of course. It's known for many years to help with cardiac function, heart function. But I will tell you there's many other beneficial effects because it helps with those mitochondria. I talked earlier about how important the mitochondria are, and CoQ10 is something that helps the mitochondria work more effectively and more efficiently. And as we get older and as we have chronic diseases, sometimes that CoQ10 level starts to decline. And I like to see my patients above 1 as far as the level, and preferably even above 2, depending on the labs that we're using, depending on the condition. And I kind of threw out earlier resveratrol. I like that one a lot. It's an herb derived, as I said, from red wine, from grapes and some berries sometimes. And this is also very effective for protecting various organs of the body. It blocks a lot of the inflammatory pathways, virtually harmless also, and it's something that should be greatly considered. It has some anti-aging properties, helps protect the heart, helps protect some of the cancer progression pathways. It's very good for diabetics and hypertensive people, And once again, they all have a base of inflammation in those conditions. Various plant sources I like a lot. Boswellia. Boswellia we use as a capsule. It's an Indian Ayurvedic herb. It's very good for arthritic problems, rheumatoid arthritis, and general degenerative arthritis conditions. It's a very good anti-inflammatory in general. Bromelain is derived from a pineapple extract from the stems, I believe, of the pineapple itself.
Core.
What's that? The core?
Core.
Okay, the core, thanks. And it is something that helps reduce inflammation greatly. It helps reduce swelling. When someone has an injury, let's say a sports injury or injured themselves in some way, taking bromelain on an empty stomach between meals can be very, very effective sometimes to reduce the swelling and inflammation. And by the way, when there's a lot of swelling, you don't heal as well because your blood supply doesn't get to it as easily in an effort to heal itself. So that's why you have to reduce inflammation, reduce swelling to reduce the inflammation. Quercetin is a type of it's a flavonoid. It's sort of you may have heard of bioflavonoids, and there's literally about 600 or 700 different bioflavonoids. Curcumin has received a lot of recognition for its anti-inflammatory effects. It works along well with vitamin C, by the way. Artemisinin is also known as, it's Artemisia artemisinin. It's it's an herb, but in a pharmaceutical grade, it's used sometimes to treat malaria and other parasitic conditions. This too has various antiviral effects, sometimes antibacterial effects, anti-inflammatory effects. And berberine is also derived from a plant. This is also known as golden seal. But berberine is fantastic for against infections, respiratory infections in particular. It's also very good against diabetes, heart disease, and once again has a very potent anti-inflammatory effect to it. So there are a lot of plant sources, there's a lot of supplement sources, there's food sources that all can potentially reduce the inflammatory response. This is just some little 5 ways if you want to also reduce inflammation quickly. Is good hydration. Now, unfortunately, a lot of Americans are they have too much dehydration in their body. They're intravascularly dehydrated. Movement, exercise, if you can. Obviously, not too much swelling. Getting some regular exercise, regular movement, doing regular yoga or stretching. Those are all important things to protect your cells from inflammation. I mentioned, or we already talked about anti-inflammatory foods and nutrition. Reduce stress and improve your sleep. If you don't sleep enough, your body puts out more inflammatory cells too. Those cytokines and interleukins, they're increased if we are under chronic stress. And when we don't sleep well, our body thinks it's under stress, and you put out more cortisol, more cortisone. Those are stress hormones, and your insulin levels can go up as a result of that too. I wrote, use anti-inflammatory nutrient supplements. We just discussed at least 8 of those things as well. So, in conclusion, just last slide, inflammation underlies almost all chronic major degenerative diseases. It also is a key factor in driving the aging process, and it also dysregulated chronic inflammation can be caused by diet, lifestyle, environmental factors that all can mediate most of the chronic degenerative diseases that we see today. And lastly, and there's something you can do about it. It doesn't have to mean that you have to live it your whole life, but you have to you have to be willing and wanting to change the way that you're living. And I also tell my patients a lot of times, when you're eating, ask yourself before you're eating that food, or whatever you're going to eat, will this food probably be anti-inflammatory, or will it probably be pro-inflammatory? So at least you start thinking a little bit. And I'm not saying you're never going to eat something that's pro-inflammatory and all that stuff, but when you start asking yourself, hey, should I really eat this? Is this anti-inflammatory or pro-inflammatory? You might sometimes back off, the pro-inflammatory foods. You'll start making a little bit wiser decisions most of the time. So thanks for listening. And what I want to do is, it's getting late, but we'll open up some questions. And hopefully you'll have some take-home messages that will be helpful for you. And we'll go from there. So what questions might you have? Yes?
What if you have oral allergy syndrome?
Oral allergy syndrome?
Right.
Do you mean like your lips kind of swell, or what do you mean by that?
Or you have a reaction to fruits and vegetables that are related to certain plants and grasses.
Yeah. So
outside.
so there are certain fruits and vegetables and other foods too that what's called cross-react with a lot of the pollens in the air and the grasses and the weeds and things like that. So sometimes when you have this oral allergy problem that you just mentioned, we actually have to test our patients for sensitivities to weeds, grasses, trees, and molds and fungus, for example. And you may have to address those at the same time. So we have a special technique that we use here when we have an allergy lab. We test our patients for the foods as well as the grasses, trees, weeds, and molds. And then we put them on what's called a sublingual desensitization program. And what that does, it helps build up the what's called blocking antibodies. It helps build up the body's immune system and reduces the inflammatory response. You also often have to treat the gut for that too, the GI tract, because whenever there's a food sensitivity, you have to think about, what's happening in the GI tract at the same time.
Right.
So you have to look at the whole body, basically. What else? What other questions might you have? Yes?
Is there a test for you to know what you're allergic to? Like,
Yeah, so our question was, is there a test to know what you're allergic to? Well, there can be blood tests that can look at allergies, and there's skin testing as well. There's different kind of blood tests because most of the very traditional tests only look, when they do a blood test, at something called IgE mediated responses. And that means that those are the immediate response. You eat a strawberry or a peanut and you react pretty quickly. The problem with that, only looking at the IgE responses, is that that's not going to encompass everything. It's only going to be one mechanism of action, and it's usually the immediate reactions. But a lot of people, when they eat something, they sometimes notice that they have a reaction 4 hours later, 8 hours later, 12 hours later, or next day or something, that they don't feel well, right? You all relate to some of you shaking your heads. So we do a more expansive type of allergy assessment, looking at various mechanisms of action. So it's not just IgE, but there's something called IgG, there's something called immune complexes, and also you can react to a food because you don't have, for example, the enzymes, perhaps, to break it down. So you've heard of lactose intolerance. Some of these people are lacking the enzyme called lactase. They can't break down the lactose. That may not show up at all on a regular, traditional IgE mediated test. So I find that, so we do more of an expansive approach to help assess it. What else? Any other questions? Yes?
What would you recommend for fibromyalgia?
So,
diagnosis of fibromyalgia.
yeah. So our question was, what can we do for fibromyalgia? So, listen, there's not one thing you can do for any of these, any condition, and each person's completely individualized. So, for example, we take a thorough history physical exam, and then I order lab work depending on what I think is most important. So, it might mean looking at your gut. We may actually order a special stool test that looks to see, are you breaking down your carbohydrates, your fiber, your fats, and your proteins? If you're not breaking down those foods effectively, you're much more susceptible to food sensitivities and food reactions, and those food reactions can cause an inflammatory response in some people in their joints. So I'm just giving you one little example. We might check, depending on your history again, for high levels of heavy metals. There are thousands of people walking around with high levels, they don't know it, but high levels of lead or mercury or cadmium or nickel or arsenic, and that's causing what's called oxidative stress and inflammation in the joints, contributing to fibromyalgia. That's just another example. We might check various vitamins and minerals. We might find you're low in zinc and magnesium, for example. Low levels of those two things have been associated with increased risk of fibromyalgia. So we take a thorough look at what's happening with your biochemistry. We would definitely, or almost definitely, do food sensitivity testing. Perhaps look at, depending if you have pets, if you have a mold, if your house has had some water in it, we may look at molds, danders. It's a very comprehensive approach because you really have to look at the whole person to effectively treat them with fibromyalgia and many other things too. Yes?
Do you accept insurance?
Do we accept insurance? Some of the lab work, depending on what it is, will bill your insurance company. For the actual doctor visits, we don't accept insurance, but you're welcome to take the bill, the receipt, and turn it into your insurance company. Some people will get some payment depending on what their insurance is, and some won't. But You know, some of the insurance companies will cover some of the labs and some of them won't cover. It really depends on the specific lab, depending on what it is. But you can always call our office and they'll give you more information specifically if you ask them specific questions, because it's hard to generalize everything. Yes?
So the 4 supplements I guess you have listed up there.
Yep.
Are you saying that we need to combine all of them, or one's better than the other, or?
So, I mean, I find them all very effective, combined basically, but depending on your case and your condition, you know, it depends on how much inflammation you have, sort of, and what you're trying to address. But, you know, I find they all work in different pathways in different areas. So these are the 4 that I like a lot, and that we've used them for years and years here. Well, one of them probably that's just 5 or 6 years, the H2Absorb, but the rest we've used for years. It's, you know, once again, it's hard to come up with a blanket statement. So every person, once again, is treated individually, and sometimes people take, you know, 2 of these, sometimes 4 of those things, and they can even take 6, because it could be something else on the list that you might be taking. Depending on, you know, if we find they're low in vitamin D, we might throw that in. If we find that their lectin-3 is high, they should be on the Pectus LC. So, you know, every person has to be treated individually, because we're all very different. Any other questions? Yes?
Do you think everyone needs to take a probiotic, or just if you're having trouble?
So she asked, does everyone need to take a probiotic? I don't know that I would say everyone has to do everything or anything, or no one has to do anything. But I think that probiotics are very useful. We find that most people feel better, but the thing is, there's so many different probiotics out there. And the biggest problem is, what do you get? What do you buy? What do you take? How do you know if they're good? How do you know if they're not good? It's all these different organisms, and you want 10,000, you want 20 million, you want 50 billion. I mean, it's all over the place. And it's very hard to be a judge, as a consumer in particular, of
But if
what
you don't
is
have any
best.
symptoms, if
No
you
symptoms.
do you need to still
Listen, you
take
could
it?
get away with using sauerkraut and kimchi and using some of the fermented foods, and that's also beneficial. Nothing wrong with that. So I don't want to say that, you know, everyone should take something, because I think it needs to be individualized a little bit. Yeah. But there's a lot of fermented foods. You know, you could buy the vegetables that are cultured vegetables are very, very good for the microbiome of the bowel. The gut.
Kumbashi, that's good too?
Which one?
For kumbashi, I think they call it.
Oh,
Yeah,
kumbashi. Yeah, you're from that one. Yeah, that's supposed to be good for your gut too.
Okay.
Yeah.
Probiotic.
But you know, there are people that say, "Hey, I get too much gas and bloating from probiotics." Once in a while, I hear that. You know, someone said that's me. Oh. Yeah.
I'm allergic to all healthy foods. They gave me a problem.
Yeah. Science. All right. Yes.
The curcumin.
Yep.
What percentage of that is in the turmeric?
I don't know. Her question was, you know, how much curcumin is actually in turmeric? I think is her
Yeah.
question. I don't know exactly. I can't answer that, unfortunately. So I don't know what percent. I know what you're asking, but I don't know the answer.
I use a
to
lot
that.
of it, but I'm just wondering
Yeah.
how much.
Yeah. I mean, listen. Using the whole
And the
turmeric
pepper.
is certainly healthy and beneficial,
Mhm.
without question, and that's great. I'm just saying that curcumin is the component that's been studied the most within curcumin, and it has a lot of, you know, it has a lot of research behind it. But so does turmeric too. So nothing wrong with that. Any last question? All right. Oh,
I found out that sugar causes a lot of joint pain.
yes.
Somebody told me that, and I noticed I had cut out the sugar, and one time I accidentally was eating cookies, and within an hour I was in so much pain.
Yep. Good. I'm glad. So she said that she eats cookies or sugary stuff. She's in so much pain within an hour. So I'm glad that you recognize that. And that's the other thing. You know, we should. It'd be good if you maybe keep a diet diary sometimes, what you eat and what symptoms that might be arising afterwards. But cookies and sugar and refined processed foods is what we talked about, can induce great amount of inflammation, and you're experiencing it in your joints. Other people, it might be in the gut. Other people could be in the heart. Other people could be elsewhere. But the fact that you recognize that is very important. So what are you going to do about that now? Are you going to
Cut out the sugar.
There you go. Because I'm a sugar. So you're wise and you're smart. Some people, even in spite of what you said that you have problems with it, they still don't stop eating it.
But sometimes sugar is hidden in things you
That-
don't even know.
That's
it's in
correct.
there.
She said, I'm repeating some of this for the purpose
Yeah,
of the tape,
that's
by the way. But she said sometimes sugar is hidden and you don't know it. That's true. And that's also why you try your best to read labels. And you try your best to eat, quote, real food that comes from the planet Earth. Then you don't have to worry about labels so much. But if you're buying it from a package or a factory of some sort, you do have to look at labels. But sugar is there's no real beneficial effects of simple sugars, and a lot of people will have a lot of joint pain from that. I always tell people, listen to your body, and listen how your body responds. Pay attention to it, because you only get one body. So, all right. So thank you very much for listening. I appreciate you all coming, and hopefully you'll come back again. I just want to.